I want to bring Senator Lindsey Graham into all of this, Senator, a close confidant of the president as well. Senator, what is your sense you're getting from the White House and from many of your colleagues about how this is sorting out or not sorting out?
Go big. The bottom line is I've been on the Hill all day. I haven't seen this kind of spirit since 9/11. Everybody's looking at each other as an ally, not a foe. People in America, you begin to see the best of the country. The young lady on the show before, delivering food to elderly people, allowing seniors to shop ahead of everybody else in grocery stores. It's going to take that kind of spirit to defeat this. But here's the problem. 80% of the workforce is going to be impacted by the containment policies. The money we're spending to deal with health care is going to pale in comparison with the money we spend to stabilize the economy. If you've been laid off today in South Carolina from a bar or a restaurant or a hotel, I'm looking to make sure that we have wage replacement, that we replace your income as much as possible so that you don't have your life turned upside down. That's the number one goal of Phase 3 for me.
So, Senator, obviously money in people's hands is always a good thing, especially for the people who need it. But is it your sense that the problem here is the virus itself and that people who are hunkered down in their homes, afraid to go out because of this, they might use that in other means and pay bills, I get that, but that it won't have the desired effect on the economy? Or is that even part of the rationale here?
Well, it's my rationale. I want to stimulate the economy, but it's impossible to stimulate it when it's locked down. If I gave you your paycheck, that would be enough to get you through until we can find a way to fully deal with the virus. Your paycheck plus $1,000 doesn't do you any good. Instead of getting a government check, I want you to get your paycheck as much as possible.
No, so I get that. Do you wonder, though, if this drags on a while, though, that people are going to be frozen in place, regardless of what stimulus is coming their way?
Oh, you can't stimulate it. We're buying containment. Everything I've just talked to you about is the price of containment. Okay. Shutting every bar and restaurant down in South Carolina is the cost of containment. We either pay now as a country or we pay later. And what do we do until we turn the corner? And what would turning the corner look like?
Got it.
A week where you had less infections than the week prior, when therapies are in place to reduce the mortality rate.
The arc is turning. Senator, I'm so apologize for stepping on you. The president is speaking right now. We're going to go to that.
Yeah, go ahead.
Fairman, Dr. Robert Redfield, and Dr. Deborah Birx. Thank you all very much for being here. Thank you very much. We're using the full power of government in response to the Chinese virus. I declared a state of national emergency that will make up to $50 billion in disaster relief funds available, which we can use to assist hospitals, which, as you know, we need. I asked states to set up emergency operation centers and hospitals to activate emergency plans, and they've been fully notified. We're urging hospitals to cancel all elective medical procedures. My emergency declaration allowed us to waive regulations to give nurses and doctors maximum flexibility to respond to the virus and to protect our frontline professionals that we've authorized through telehealth nationwide, which is really becoming big stuff, telehealth. Makes it a lot easier for patients and really has been working out amazingly well. We empowered states to authorize tests developed in their state, and we are working with the private sector to rapidly expand testing capacity. We have literally rebuilt that whole system. It was an obsolete system and has been rebuilt, and a lot of good things are happening. We've ordered 500 million N95 masks to drive private production. American manufacturers are repurposing factories. One major manufacturer has already doubled capacity, and we've asked construction companies to donate unused masks, and they have actually quite a few of them, the construction companies. Who would think that? But they're going to be donating unused masks, and the Defense Department is making millions of masks available for healthcare workers. And we're asking every American to make major changes to reduce social interactions over the next 2 weeks. As we all know, We must make shared sacrifices, and that's what we're doing as a country. It's been amazing to see the way the country's come together. There's tremendous spirit, and even Republicans and Democrats are getting together for the most part, but they're getting together. So that's a good thing to see. I thought maybe I'd go around the room and we'll just say your name and who you're representing, and it's great to have you. Thank you very much. Please.
I'm Dr. Debbie Hatmaker. I'm the Chief Nursing Officer for the American Nurses Association.
Great. Thank you, Debbie.
I'm Dr. Suzanne Miyamoto. I'm the CEO of the American Academy of Nursing.
I'm Dave Hebert. I'm the CEO of the American Association of Nurse Practitioners. Thank you for having me.
Thank you very much.
Mr. President, I'm Dr. Deborah Troutman. I'm the President and CEO for the American Association of Colleges of Nursing.
Great. Well,
I am Teresa Davis, and I'm a Clinical Operations Director in an EICU, but I am representing the American Association of Critical Care Nurses.
thank you very much. Great.
Hi, I'm Ron Kraus. I'm the 2021 National President for the Emergency Nurses Association.
Thank you very much.
Hello, Mr. President. I'm Robin Begley, the CEO of the American Organization for Nursing Leaders and the CNO for the American Hospital Association.
Thank you very much. I know who he is. Mike, do you have anything to say?
Well, just, Mr. President, I just want to join you in welcoming these great healers to the White House. The President spoke today to the leaders of physician organizations from around the country. We garnered from them recommendations about how we can further support those of you that are coming alongside Americans that are impacted by the coronavirus. And as the President said, we are absolutely committed to bringing the full resources of the federal government, the full resources of the American economy, to work with states across the country to be there for Americans struggling with the coronavirus, but at the same level of priority, the President's made it clear that we are to make sure that the men and women who are serving those patients and the nurses, the nurse practitioners, the emergency room nurses, so well represented here around the country, are in the forefront of the President's mind. And as he said, we've taken decisive steps where we've enabled the expansion availability of N95 masks, and Congress has worked in a bipartisan way to make those more available. We're working on gowns and gloves and all of the personal protective equipment that all of you rely on every day. And I look forward to the discussion today about how we might be most helpful, but I hope you will carry back the gratitude of your President and of our entire team on the White House Coronavirus Task Force for the work that all of your members are doing every single day. They are the hands and feet of American compassion, and every American is grateful to our nurses.
Thank you, Mike. And just for the media, FEMA is fully engaged. We're working with them very closely. They're going around. They're seeing many of the states. They're engaged all over the country, but some areas have far greater problems than others. Some areas don't have very much of a problem at all, as you know. But FEMA is very much engaged. They're fully engaged as of about 2 hours ago. And tomorrow we're having what I think will be a very interesting news conference. And I think you know what that's all about. So we'll see. The FDA will be, they've been working very, very hard, and I appreciate what they're doing. And I think we have some very interesting things that will be brought up tomorrow at the news conference. It'll be set up, I think, at around 11 o'clock or so, but we look forward to seeing you tomorrow. Thank you very much, everybody. Thank you.
All right, I never know when to leave, but they do save time talking over one another, so there is that. Senator Lindsey Graham was kind enough to stay with us, and as we were listening to the President, the Senate has gone ahead and passed, as Lindsey Graham suspected it would, this coronavirus response that measures include sick leave for workers as well as free testing. Now, that latter part is of interest to me. I know you had yourself tested for the coronavirus because of an official you ran into, I believe at Mar-a-Lago, sir, who had it, and I guess it came back negative, so there's a little good there.
Yeah, it's another test I failed, and I'm glad I failed this one.
That's a good one to fail.
Yeah, well, it's the Australian ambassador I met. But let me just tell you a couple things. What the president talked about is efforts to ramp up the ability to contain the virus. God bless the doctors and nurses on the front line of the fight. But what I'm looking at trying to accomplish here this week is to create a revenue stream, an income stream for everybody who's lost their job, not a one-time payment, but income that you can count on. You know what the maximum benefit for unemployment insurance is in South Carolina per week?
I don't.
$326. That's not enough. So there's bipartisan support to have the federal government to put more money into the unemployment insurance system. What I'm talking about is 3/4 of your salary up to $80,000 is a general idea. There seems to be a lot of Republican and Democratic support for that. Marco Rubio and Susan Collins have a great idea. If you're a bar owner or business owner and you've had to shut down, you can go to the Small Business Administration and get a loan to pay your employees up to $80,000 per employee, and we'll forgive that loan for the first 6 weeks to keep the paychecks coming. Between those two ideas, we're trying to stabilize people's income.
You know, what's interesting in the middle of all of this, and it can't be helped, but we're looking at a possible recession. Goldman Sachs says in the very quarter we're in, Senator, and that it could linger for a while. Even Secretary Mnuchin, even though the president corrected him, said if this whole measure were not to pass or ultimately be signed by the president, unemployment could jump up to 20%. What did you think of that?
Oh, I think the unemployment rate in this country is far more than 20%. I think we've locked the whole economy down. People are not unemployed. They've been furloughed because of a medical condition. Nobody's lost their job because of bad economic policy. People are out of work to contain the virus.
No, there's no doubt. You're exactly right about it. Are you worried that whatever the reasons, it's going to grind this economy to a halt for an extended time and maybe for right through the election?
Here's what I think. I think the containment policies are aggressive and will pay dividends. I'm looking for three things. 1 week where the infection rate is less than the week before, when therapies save lives, and when a vaccine is on the horizon. When those three things happen, the economy will begin to work again. It can't be stimulated. It is completely shut down as part of containment. So the number one issue for me, and I'm a broken record here, is I want you to have an income stream until we can contain the virus, not a one-time payment from the government. That income stream can come from your employer through loans to them or through increased unemployment benefit checks.
You know, Senator, when you look at this and what's happening right now, the feeling seems to be that cities are emptying out, and in countries like Italy, the whole country is essentially in a lockdown. Everyone's quarantined inside their homes. Now, I have some Italian relatives who are singing from their windows, so they're putting up with it the best they can, Senator. But do you think that could happen here? Should it happen here?
Well, our current policy is stay away from places where there are more than 10 people. When you apply that rule to the economy, how many people will stay in business? Now, part of the economy is still functioning, but you had all the major car companies stop work today. If you want to contain the virus, you got to keep people away from each other.
So what did you think of these kids in Florida and there elsewhere who are in groups significantly larger than 10? I'd say some of the video that I saw, Senator, in excess of 50 having a grand time during their spring break.
You're doing the country a great disservice. You're putting your parents and grandparents at risk. We need the spirit of World War II, where everybody was in it to win it. The war on terror, 1% of the country has been fighting radical Islam. In the war against the coronavirus, all of us are key players, all of our soldiers in the fight. My job is to work with the President and Congress to contain the virus through medical breakthroughs as quickly as possible, but also to stabilize an economy that's in free fall right now. 80% of the American workforce is going to have a hard time getting a paycheck due to our containment policies. We need to come up with programs to replace their income so they can get through this without losing their entire lifestyle.
All right, Senator, thank you, and for your patience through that. I appreciate it.
Thank
Senator
you.
Lindsey Graham.